and welcome to this episode of Cite. I'm Dr Jasmine B. MacDonald. Today I'm catching up with Dr Abigail Alfrey about the role animals can play in mental health practice and cognitive assessment. I hope you're going well and have settled in with a warm cup of tea. Abby, welcome to Cite.
Hello.
It is so lovely to have you here. I appreciate you taking the time for a chat, and I'm also especially excited because you're the first international guest on the show.
Well, I'm very excited to be the very first international guest on your show.
Today, we're going to catch up about your expertise area in really experiential and creative approaches to clinical practice in psychology. But what I like to do is to start a little more broad and so that I and the listeners can get a sense of you more holistically as a person. So I wondered if you wouldn't mind talking a little bit about yourself and covering things like where you grew up and how you got into psychology.
Sure, yeah, the two are really linked and I think tie in really nicely with this topic today of talking about animals in psychology. So I was really fortunate. I grew up in a small holding in rural countryside of England, and so I grew up with the luxury of like surrounded by animals. We had horses, I had a dog and chickens and geese and all of that kind of stuff. So right from the word go, I was like surrounded by nature and animals and got to really experience the advantages that that had on my developmental process, my growing up, the ups and downs, I suppose, that come with that and how you manage your emotions. So that led me really directly into psychology and mental health. And I actually kind of got into psychology through trying to understand the animals and animal behavior more than the human side. That kind of came later. So I started off working with animals that had, well, particularly horses that had phobias or traumas.
Whoa,
Yeah,
interesting.
yeah, because, well, we didn't have tons of money, so I didn't buy flashy horses, but I would help sort of rehabilitate horses that had had traumatized background, help them live more sort of fulfilled lives, I suppose. And I learned a huge amount about, I suppose, the more behavioral aspects of psychology there and nonverbal communication, development of trust, which was all very nice foregrounding for working with people. But
Absolutely.
a slightly different route in than a lot of people take.
Yeah, nice. So, how did you come about thinking that therapy was something that would really motivate you and interest you?
Well, I guess I saw the effect that it had on the horses when I was working with them. So, say I got a horse that had a really bad experience going into a horse box for traveling, like shows and moving around and stuff, or I had a horse that wouldn't go over certain jumps or wouldn't go near certain stuff that freaked them out. I had that experience of working one to one with them, building the trust, seeing the gains week on week, and really having that experience of doing something useful. And that was beneficial for me and for them. So that really gave me a bit of a hit, I suppose, that I wanted to keep chasing. And working with people was just such a natural extension of that. Like
Mm,
once I got into working with people, actually the benefits were even broader because you see the suffering around in the world and you see the difficulties and challenges that people go through every day,
right.
myself not excluded, and I'm sure we can all connect to that. So
Yeah.
doing something that really felt like it was making a difference and that you're there connecting with something real was really, really important to me. I couldn't have done like a desk job where I was doing something kind of abstracted, and I'm sure no disrespect to people that do at all, but I think I would have gotten really, really switched off with that kind of work.
Yeah. I'm wondering about then your pathway in terms of your formal training. But I guess double barreled questions aren't good. Try not to do that. But here's one. How much did you feel aspects around the human animal interaction was included in your training?
Yeah, not so much, which was interesting for me. So I'll answer the first part of your question first. So the route into clinical psychology training in the UK, and I don't know if it's the same or different in Australia, is pretty long-winded. You're generally expected to, you have to have an undergraduate degree in psychology. For me, that was a joint degree with philosophy and psychology. Then you're kind of encouraged to have a master's. You don't have to, but if not, then heaps of professional experience. So I worked first off as a support worker and then as an assistant psychologist. I then did go on to do a master's in mental health studies. And from there, I went on to do a doctorate in clinical psychology. So that's then a 3-year training funded by the NHS, that's our National Health Service, and really learning the theory practice link. So getting out into the field and developing your skills as a clinician, but also as a researcher. So always having those two hats, a sort of scientist practitioner in inverted commas.
Sure.
And the
Yeah.
second part of your question was about how much were animals integrated into that. And yeah, it was really surprising for me that they're not really included at all. In fact, I don't think I've heard them mentioned once.
Mm.
Which, coming from my background growing up on the farm, where it was just such an intuitive aspect of how I managed my emotions, and just being a human being, where you talk to people and nearly everyone you know has an animal or has an interest in animals. That's not quite right, but there are lots of people out there that don't like animals. But it is a statistical norm in Western countries. So in the US, I think it's about 70% of people own a pet.
Right.
In the UK, it's about 50, 45, 50. I don't know what it is in Australia.
Yeah, I'm not sure actually.
It would be interesting to know. I mean, I'm sure the data's out there, but generally you find that kind of the more rural the place, the more animals that there are in people's lives. Makes
Yeah.
sense, right? And I'm sure that lockdown and the COVID context has changed that too. Be interesting to see what trends emerge in the coming times. So really baffling to me that animals just weren't included in any of our training experiences. You go into clinics and hospitals and health teams and there are no animals to be seen. You hear of it happening every now and again, but it's rare.
Mm.
And it seems such a strange, sort of counterintuitive way of managing people's health is to take away the things that they enjoy and that keep them well and the connections that are meaningful to them. So I wanted to change that.
I won't get emotional, but I did recently lose our doggo. We were
Mm.
guardians of a fur baby for 16 years. And you really realize how many dogs and pets there are around when you don't have your own anymore. And so, as a little kind of point ahead to one of your papers, we're going to talk about when those service users were talking about bereavement and how that might impact their symptomology or their experience. I was reading the paper and reading it in a whole other way. And it was just, the work is so relatable. In a broader sense, the work that you do is that experiential creative stuff. So we're not going to focus on it today, but I wondered if you might just like sprinkle in there for listeners a little bit of the other things that you're interested in, because I suspect they'll want to look at your other work or look out for future things that you might have happening.
Yeah, sure. I mean, generally anything that connects people with their human side is what interests me. So anything to do with the creative arts, movement, the natural environment, that's all the kind of stuff that interests me that I do in my clinical work and that I research as well. So I've had a couple of papers out recently about poetry therapy.
Nice.
That's a real interest to me because it's so accessible. So, all you need for poetry therapy is a pen and paper. You maybe don't even need that, arguably. And it's accessible for all ages, most backgrounds. As long as you have some degree of literacy, then you can engage in poetry therapy. And again, people light up when you talk to them about this stuff. If they're into it, then I'm into it. And I want to kind of integrate that into the healthcare that I provide. So that's a piece of work that's come out quite recently. And we've got another paper that's just going through final checks before it's published this week, hopefully next week.
Nice.
So that's exciting. And then we've got a few irons in the fire. So I'm looking at a piece of work around psychodrama psychotherapy at the moment.
Ah, cool.
So, kind of dipping my toe in that. I've also got a manuscript that's just been submitted around mindful sewing, so mindful textile exercises with
Nice.
mums. So that was a really nice piece of work that I did a little while back. So yeah, anything really that gets people kind of integrating things that they're interested in and trying to find sustainable ways of managing emotions, managing the ups and downs of life, and the
Mm,
things that make life tricky, like relationships and
mm,
communication and boundaries and all of that. I think makes so much more sense if you can integrate it into what you're already doing.
mm,
Then, once our meetings have ended, so I might see people for say 24 weeks, 6 months. That's quite long in terms of the NHS, in terms of what we provide, but in terms of your life, it's not that long.
mm.
Like 24 meetings, that's like 24 hours, that's a day.
Yeah.
So, how can I give you the skills that you can then take forward and maintain throughout your life? And I think working with animals is great because if you do have a pet, then that animal is with you all the time,
Mm,
or at least, most days, right?
yeah.
So if you've got the skills to kind of ground yourself just by interacting with your pet, then you don't need me after a while. That gives me a lot of confidence that I can say goodbye and have a good ending with a client and know that they're going to carry on doing good work for themselves.
Yeah, I really like that, almost like touching on that context dependent memory and bringing in these other cues to keep people thinking about what keeps them calm, what keeps them balanced, perspective of what's important. as well and keeping you in the moment.
Yeah, absolutely.
Having these things that draw people into a therapy context or a self-development context that they're already connected with, so it doesn't seem like it's this scary thing that I'm, not familiar with, and incorporating sewing and incorporating poetry, stuff that already is meaningful for them.
Right. It's massive. So, in one of the poetry papers, which is out there at the moment, we developed a model of poetry therapy, and it's a kind of looks a bit like a triangle. And the very top of that triangle is engagement. And there's something about poetry that brings people, if you're into poetry, it brings people into the therapy room to start with. Now, without that, we've got no therapy. If we haven't got bums on seats, then we're not doing any good, right? It's
Exactly, yeah.
it's pretty basic, but not many models really integrate what draws people in,
Mm.
which is the foundation of any kind of psychotherapy. And I have a really strong memory of interviewing a participant for that project. And she said to me, she was a CBT psychotherapist just by chance. I hadn't recruited a therapist, but she happened to be one. And she said to me, it's funny because I'm a CBT therapist. I believe that CBT helps. But when I'm distressed or anxious or sad or lonely, I don't pick up my CBT self-help book and page through that. I pick up poetry. And it was such an obvious thing. I thought, yeah, that's what we all do. We go to the things that naturally soothe us and contain us and connect us.
Yeah, and you kind of need to do that before you might get to more of a like front brain, purposeful working through something in a rational sense or reframing. You need that soothing and calming, and I guess, I don't know, I want to use the word intuitive.
Part of it comes down to motivation. It's intrinsically motivating to do that kind of stuff. Whereas you need a bit more extrinsic motivation to do your CBT homework, right? Like,
This is true.
they're not mutually exclusive. So, well, there's a saying within poetry therapy that it's a tool, not a school.
Right.
And it's kind of like a cloak that you can put over your CBT or over your psychodynamic therapy or whatever modality you work in, right? And there's so much that you can kind of frame in terms of CBT language that you don't even notice you're doing it when you come to do your poetry. So if you think about behavioral activation, if you decide to go and write a poem, that's behavioral activation. Right,
Right.
you've done something, and then you get all of the feel good stuff of I've achieved something that I'm proud of, that I want to share with people.
Yeah, nice.
You're doing CBT, but you don't necessarily know it, and it doesn't feel as separate from the self as I
Mm.
think we might have a tendency to frame it sometimes.
I was thinking today it would be great if we could focus on, in particular, two pieces of work of yours and use that to talk about what animal assisted work or human animal interaction looks like in therapy. So we have the review paper where you looked at the presence of doggos, and that's just how I'm going to refer to them throughout the episode. The presence of doggos when doing cognitive testing with children, and then the other was pet ownership amongst service users of a community mental health service. And I guess I want to put it to you about, where do you think would be the better place to start?
I'll do them in chronological order. So I actually, although they were published separately, as you know, these things can get a bit confused in the land of publication. So yeah, I actually did the piece of work in the community mental health team first.
Okay.
That was the first piece of research that I did, like formal research that I did, looking at animals in a mental health team. And this was a piece of work that I did in central London. So like the urbanist of all the urban environments. And I was looking, and it was a psychosis recovery service. So people who came into the service had had psychosis for at least 3 years
Mm.
of a level that really wasn't being managed at the primary care GP kind of level.
Yeah.
So a lot of them were on depot medications, so needing regular injections. A lot of people were coming in for mainly medication based treatment, actually. And some people were engaging with psychotherapy and occupational therapy, but for the most part, it was quite a medically oriented service.
Mm.
And there were issues with that in terms of client engagement. So, generally, if the only thing you offer people is something that's a bit scary and might restrict your freedom and isn't generally very nice, then people don't want to come. That makes
Mm.
sense, right?
Mm.
And it was really tricky. So, as a clinician and hopefully an ethical clinician, you want to give people a good experience of your services.
Right.
And we were really thinking about what can we do to improve this for people? How can we change the narrative so that we're not just a service that kind of gives people injections and sends them home again, but actually engage with people on a one-to-one human level and really build good, meaningful relationships. And of course, there was already lots of good work going on there, but noticeably absent was any kind of animal connection.
Yeah.
And for a lot of our service users with psychosis, they were really isolated in terms of people.
Mm.
A lot of them were estranged from their families, they didn't have big social networks.
Mm.
But we found out that a lot of them had some pets.
Hmm.
And the pets were so important to them. And we were hearing these stories just when people would come in and talk to us, they'd mentioned that one of them had a snake and the snake had gotten out this week, and the
That sounds
fiasco of trying
terrifying.
to. To me, it does. To me, it sounds absolutely terrifying. But they were just distraught that they'd lost this snake, and then they were joyous that they'd found the snake again. And we started to just tune into these stories that we were hearing, and we thought we're going to audit this and find out how many of our service users have pets,
Right.
and how can we take that into account when we're sort of designing and delivering their care. And it was kind of a twofold process. So on the one hand, we found out some information that they told us, and so people filled in just a really, really brief audit questionnaire of, do you own a pet, yes or no? Have you ever owned a pet, yes or no? Because the course of the illness, we wondered if that might have impacted pet
Yeah,
ownership as well,
absolutely.
and people's migration stories too. I mean, London's a really transient place, so we were interested in that, but also interested in hearing from them about the pets and the connections that they did or didn't have. And many of our clients were sort of in and out of hospital, so what impact did that have on their pet connections?
Mm.
And really getting into it, there's a lot of literature out there about the advantages of having a dog if you have sort of depression and anxiety, and that's really helpful research. But there really wasn't much out there about people that have severe and enduring mental illness.
Mm.
And we just didn't know if the research that was out there applied to our service users or not.
Mm.
So, yeah, we got chatting to them, found out about how important animals were, but also the process of talking to them was so striking. Like, suddenly, people were like queuing up to come in and talk to us, and they were, they'd come in and they were ringing the psychiatrist who's one of the authors on the paper, and saying like, "Can I come in and talk about Steve, my dog, or whatever?" And he was like, "Well, this is new. Like, this is this, this is totally not what we're used to having." And actually it got a little bit competitive as to who might want to be involved, and we couldn't get people out the door. We thought we'd interview them for like 20-30 minutes, wanted to keep it really manageable for people, and we couldn't get them out the door. Some people brought in photographs, someone brought in some drawings they'd done of their cat,
Oh my
um,
gosh.
but they wanted to share their lives with us. And I thought, this is the magic of it, this is the work.
Definitely. And in hindsight, when you think about it, of course that's the reaction. Of course they're going to be so excited to share these experiences. But it's just so far from what we might instantly think of when you think of a service like this. Yeah.
Yeah, totally. And as soon as we started doing this, people were sort of rolling their eyes and saying, "Well, what's the point of that? Like, what are you going to suggest, that they bring their cat into appointments? Don't be so silly." And no, we haven't suggested that, although,
Is it
who
so
knows,
silly?
maybe.
Yeah.
Yeah, I think you can probably guess what my position on that might be, but in the interest of diplomacy, I'll keep a nuance here. But yeah, I mean, there are so many things that we can do. And actually, the experience of talking to people about their pets, they really lit up. And we realized this is the way into those difficult conversations that we cannot get people to have. The risk management conversations. What happens if you go into hospital?
Mm.
What keeps you alive in the moments when you
Mm.
just really, really don't see any point?
Yeah.
What keeps you grounded when you forget what's real, when you feel disconnected from yourself, from the world, from other people? What brings you
Mm.
back? And
Mm.
animals was the answer. For a proportion of our service users, is animals. So many people said, "I wouldn't be here if it wasn't for Bruce, my dog." They've got me through really, really tough times. They're a reason to get up in the morning when I just would rather stay under the covers.
Mm.
It's given people pride, it's given them companionship. There was a lovely soundbite, it's actually in one of the papers, from a lady who'd been experiencing bullying, and she said, "No, we stand up to these bullies together. We do not like bullies." And it's just that sense of camaraderie that people get from their pets, and
Definitely.
togetherness and family. So
Yeah.
important. Yeah.
Yeah, one of the things that really resonated with me was the role in terms of being a caregiver, but also pride, like you said. I think one of the participants said they nursed their cat through a time of being really ill and that was really hard, but how proud they were that they got through it together and they could take care of their fur baby through that time.
Yeah.
And the other part was the role it played in their sense of self and identity. And having a 16-year-old Staffy that I watched get older and older, I had anticipated we wouldn't have him much longer, but what I hadn't anticipated was after the initial grief of losing him was, well, what now? I'm That's part of my identity gone. I don't care for this little furry thing that otherwise used to follow me everywhere all the time, especially working from home.
And you have to remember that, for these clients, a lot of them are in the patient role. It's a very medicalized healthcare system here in the UK, and they come in and a lot of them are called patients. They have an illness, and we might test that. But the reality is that is a lot of the time the language that's used and the kind of positioning that clients might find themselves in. And suddenly they're the nurse, they're the
Mm,
caregiver,
mm,
they are able to help someone else. And I think that is so important that we can hold both roles. We're all a patient at times, we all get ill at times,
mm.
but we all also have the power to help others.
Yeah,
And both are really, really important to be able to receive and to give care
yeah.
in terms of people's identities. And like you're saying, that role of caregiving and companionship is massive. And I really remember someone, well, lots of people talked about grief in the paper. There just wasn't the space to talk about everyone's experiences, unfortunately. But the emotion that would come over people, as with our conversation now, of it is grief, it is proper grief. And often I think a much less complicated grief than we have when we lose people, because our
Mm,
relationships with animals are in the here and now. They're straightforward, they're quite pure often.
yeah.
And I'm sat here drinking out of a mug with my Staffy.
Oh,
um
you have a Staffy? Oh my, what's the
well,
chance of that?
I don't have him in my life anymore, but I have this mug as a reminder. It's him looking at a tennis ball, and he never ever took his eye off the ball,
Of course.
and he taught me so much.
Exactly, they
Yeah.
do. They do.
Yeah.
Yeah.
It's wildly underestimated by healthcare professionals, the impact that a relationship with an animal has. I think they get played down and really done a disservice to. Like, oh, it's just a cat. It's
Mm,
not just a cat. For some people, it's their whole world. It might be the only person, and I'm going to use the word person.
mm.
It might be the only person that they actually trust,
Yeah.
that's actually been with them through the ups and downs.
Yeah.
Hugely, hugely important. And I really don't think we give credit to that. I don't think we ask the question enough. Do you have an animal in your life? What's your relationship like with that animal? Both in terms of meeting the person and taking an interest in them, but
Mm,
also being aware that if that animal gets sick or gets lost or is coming towards the end of its life, you talked about your 16-year-old dog and having that realization that this can't go on forever. And the same is true for our patients. And if we're thinking about relapse or illness, we need to be aware of those risk indicators as well and add some extra support in around those times.
yeah. Yeah, absolutely. And you touched on hospitalization. So I guess maybe a really practical aspect in working with people might be having a care plan. When I'm unwell, what do I want this to look like? Is that something that kind of was coming out in the discussions you were having?
Yeah, absolutely. And one of the service improvements that we implemented in that particular team was that now anyone has it on their record if they have an animal in their life. And it's standard practice to integrate that into their care plan if they do.
That's awesome.
So, yeah, and such a simple change, but a really relevant one for, I think, any team. It doesn't matter where you're situated. We were in central London. People are saying, what's the importance of pets? Well, people still have pets in central London.
Mm,
And yeah, the importance is that we can ask about them. We don't have to bring them in, but we can ask about them and we can find out about how they might open up a conversation, which can be really difficult. Care planning can be really triggering for people.
mm,
Often, when people are well and able to have that conversation, they don't want to think about times when they're not well.
yeah.
But if they can think about, okay, well, what happens to my dog when I go into hospital? then that encourages that, okay, we're going to plan for the worst, but hope for the best kind of
Mm.
mentality.
Mm.
So, yeah, simple changes, but hopefully quite important ones.
The way that the paper was written, the things that you were drawing out from people's experiences really highlighted the social facilitation that pets play in terms of, sparking up a conversation. But you've got me thinking with what you were just talking about then, potentially keeping others in the loop when you're not doing so well, because, well, now you need to reach out to somebody to take care of your pet.
Yeah, yeah. There was one lady in the paper that she really made friends with. She lived in a block of flats, and one of her downstairs neighbors would look after the cat whenever she went into hospital. And they've stayed friends. This lady who looked after her cat, she's moved away now, but they still write to each other. They're in contact. Really meaningful, lasting friendship that was built around some real vulnerability, actually.
Yeah.
And it's hugely important to people. I mean, we also asked people that didn't have pets, why not? And a lot of it was around, well, what happens if I go into hospital? And I think if we can help people think about who could you talk to about this, and also let them know what happens naturally within the service. So we do, if someone is unfortunately detained under our Mental Health Act, then we do have a process of the pets. We have a relationship with kennels and catteries and things, and that is a whole part of the process, that's taken care of, and that your pet's not just going to be left alone and nothing terrible is going to happen. But if you can have that conversation up front, then you're in control of where they go, and you know that the animal is going to have a good experience. You feel confident in their care. And
Mm.
the conversations you can have with neighbors or family members, they can be so, so important. And breaking the ice, getting people talking. If you walk your dog once, twice a day and you meet other dog walkers or people want to come say hi and pet your dog, you've got some social contact in your life. And that's a springboard, right?
It's true. Even in walking Taz, our staffy, even people who didn't necessarily want to talk to us would talk to him. Just stopping and having a conversation with somebody, or I don't know how many times in the 16 years we had Taz, I'd have people come up to us and say, I had a staffy at one point, or like just love dogs in general. And it connects you. That's really cool.
Yeah. I mean, I'm going to own up to this and say I'd never spoken to my next door neighbor until my cat got stuck on her roof, right? Like,
It was a good strategy of the cat to form relationships
yes.
for you.
Sometimes they do, and you just have to kind of go with it. And actually, we're now in touch, and we have a much more healthy next door neighborly relationship. But I think that happened quite soon after I moved in, I will say that. But yeah, I think these things happen, and they get people talking, and they got people talking in the waiting room too. So
Mm,
some people talk, and this was a really painful part of the study for me, was finding out just how scary people found the waiting area.
yeah.
And that title of the paper, Why Should the Fish Feel Safe? That was so striking to me. I just thought we're asking people to come into a space where they actually wouldn't bring an animal, even though it would bring them comfort and make them feel safer in this place. They actually would rather protect the animal and leave them at home and take it themselves,
Mm.
which was super painful for me and something that really absolutely needs to be addressed.
Shows how brave they are to show up despite how uncomfortable and scary the situation is.
Yeah, absolutely. People, even though their animals weren't there, they still got talking about them. So
Mm.
one lady had made friends with another person who was sat in the waiting room because they found out they both had cats, and they were like, "Oh yeah," sharing stories about what had happened, and then the phone's out and they're showing pictures, and we can all relate to that. I mean, how many social media memes, videos, etc. are out there right now? I mean, I think this entire businesses, TikTok, I'm pretty sure is founded on animals like doing cute stuff.
Uh-huh.
So we're interested in it. We bond over it. We share it. We talk about it, and it's a huge social lubricant.
Ah, animals are the best. I guess in the conversation we've had so far, you've already highlighted a number of ways in which, for the people you spoke to, having a pet was challenging, but also it was something that could be really protective in terms of isolation and symptom management and stuff like that. I'm wondering about tips or insights from this work and your broader experience that you might have for individuals around their own mental health and pet ownership, and clinicians and the role of animals.
there's reams and reams of ways in which animals can be helpful. So I think one of the papers we'll move on to talking about is that review paper where it looks at how dogs might support children, young people that are going through stressful things such as clinical testing, so cognitive assessment. I'm going to talk about why that's the case. And I think generally it's about attachment systems, right? So hopefully attachment is a word that's on people's radars much more often now.
Mm.
And anything that connects you with that attachment system it's neurobiological. So if you're around an animal, then it activates your attachment system and it gives you all of those feel good chemicals, the oxytocin, that bonding chemical, and it makes you feel better, less stressed, like more relaxed. And I think anyone can take that into their lives. If you've got a pet, then you've already got really good access to something that's going to help you feel soothed, that's going to help you feel supported. And I think anything you can do to kind of, I suppose, notice what the gaps are, what the challenges are in your life. If you are wanting to have more exercise in your life and you've got a dog, then that's a natural motivator to kind of get up and do some exercise with the dog, right?
Mm.
Back to behavioral activation, I suppose. But I work quite a lot with the model of compassion focused therapy. And that talks about kind of three core systems that we have. We have the threat system, the soothe system, and the drive system. And I think most of us tend to spend our lives somewhere between threat and drive.
Mm.
Either we're sort of alert to the kind of the dangers, and whether they're social or whatever they might be, or we're kind of trying to achieve something. Certainly
Mm.
myself, I find myself in drive system a lot. But that soothe system, we just don't do much with that soothe system. And that can really cause problems when the drive system goes offline for whatever reason. If we're like super tired, or if we get depressed, or whatever happens to stop us getting engaged with that drive system, and we have no soothe system, then we're really high and dry.
Mm.
Animals are wonderful for activating our soothe system, just hanging out with them, like stroking them, you know, being together really, really important. And like anyone can do that. Even if you don't have a pet, just go find some animals somewhere and go say hi to them. So, yeah, I think that's pretty accessible, hopefully, for people.
Mm.
For clinicians, I mean, these days, actually, pets are way more part of clinical experience than they ever were because we're doing so much work remotely.
Yeah.
So if I'm seeing a client via Zoom, and maybe this might speak to my boundaries as a clinician, but the dog's walking in and out, having a good
Yeah.
bark, like, what can you do? So, animals have been a part of my work even within the NHS, where strictly speaking, well, no, very strictly speaking, we don't allow animals into our clinic. But when I'm seeing someone on Zoom, the animals come in and I integrate that into the work that I do with them. So if the dog is really, really barking, rather than thinking this is disruptive to the therapy, I'm like, wow, Bruce is really having his opinions known right now. Like,
Mm.
what's the impact of that? Oh, well, he wants this. Right, okay. So he's really found a way to let you know that he wants that. How do
Yeah.
you let people know when you want that? Oh, I don't really say. It invokes these kind of conversations about communication, getting your needs met.
Mm.
Or I remember having a session with a client who was talking about a really traumatic event in their childhood, and their dog just came and sat on their lap. And actually, that was enough to ground her and keep her feeling tethered to the present moment and
Mm.
feeling soothed, that she was able to kind of reach back into that really difficult memory, connect with it, work through it, and then still stay anchored to the here and now. And I think that can be really difficult sometimes when you're working with clients in the therapy room. Like trying to keep people anchored when we're talking about trauma can be hard and quite dangerous if we don't have that anchor.
Mm.
So if animals are in people's lives, I use them, definitely.
Super powerful. I can't remember who I was talking to. I was having a catch up with someone and talking about like mindfulness meditation. And there's a couple of different apps that I use because I usually am also in drive mode. And in one of the apps that I use, there was pet, like co meditation. And it was like, sit near or, next to your pet and listen to them breathe, or put your hand on them and just feel them breathe in and out. And that kind of integration is really nice, and that sense of sharing a moment. Mm.
Oh, goodness me. Yes, absolutely. This is more or less my entire business model where I work privately. I do some work on a farm. So much of it is about mindfulness and involving the animals in that, because one of my favorite sort of factoids about human animal interaction, particularly with prey animals, so horses are really good at this. They are very alert to threat signals. They exist within the herd. So their heart rates synchronize with each other. So if one of them picks up a threat signal and the heart rate elevates, then all of their heart rates will elevate. And it's the same with people. So they can hear a human heartbeat from 2 meters away.
Whoa.
So if I'm feeling anxious and I go hang out with a horse, there's this sort of old wives' tale, a sort of folk tale that as a horse rider, I was always told, you need to be calm because the horse will sense your fear and they'll pick up on that, and they need to take their confidence from you.
Mm.
And it was so exciting to me when I found these research studies that are actually telling you, yeah, that's true. And this is why. They synchronize with your heart rate. They literally show you your emotions, they act them out for you. And that's so important as sort of biofeedback, really, for people to regulate their own emotions and see, oh, that's what effect my emotions are having on myself, on the people around me.
Right.
And I can right here, right now, take a few deep breaths and look what happens. The horse has actually slowed their breathing down too to match mine. It's an amazingly powerful but very simple intervention. And we don't just do it with horses, we do it with guinea pigs. I've got a client that I'm working with at the moment, working with a family. And we quite often do like a guinea pig meditation just to end the session. And it's such a comfort just to be stroking and attending to the softness and the warmth and the regulation of their breath, and
Mm.
just seeing the impact that your emotions have on theirs and their emotions have on you, and finding some balance in that dance between the two. I even did that in a call with an NHS client. I had someone call through that was really, really distressed, someone who has a very, very traumatized background and can experience episodes of dissociation where they really don't know what's real, if they even exist. And as I'm talking to her, I was asking, what are the grounding techniques you've been working through with your? She works with an OT, occupational therapist, and she said, "Well, I've been stroking the dog." I said, "Okay, great. Where's your dog right now?" Her dog was called Fluffy, and so she's like, "Oh yeah, no, she's over there." So the dog comes over, and all right, okay, right. So let's spend some time. So would your dog be all right if you gave her a little stroke? So she's stroking the dog, and I'm like, okay, which bits are softest? And she's saying, well, the ears are the softest. And okay, which bits are the warmest? Okay, well, she's warmest under her tummy. And we were really grounding into that moment just over the telephone. It's really accessible if people do have animals.
Mm. And this gets me thinking around the decisions you might make on the farm of what situations might it work best to work with a horse or a guinea pig, keeping in mind the stress and comfort of the animals that you work with as well, because you're trying to balance both in the whole process, be effective as a clinician and make sure that it's useful for the person that you're working with.
Yeah, there's a lot of balancing to be done. A lot of it comes from take a very person-centered stance, and it comes from the client's preferences, their goals, what they want to work on at that moment in time. And some people, like I've got a client at the moment who said, like, I'm just terrified of horses. Now that's not to say we wouldn't ever work with a horse, because maybe at some point they'll want to kind of manage that anxiety and think what it's like to bring that anxiety into the space. But at the moment,
That's a
I'm not gonna
different
bring a
goal.
horse into yes, we're not going to do that until a time comes when they might want to do that and see the utility of it. But at the moment, we stay on this side of the fence. We might go say hi to some of the animals, but they're in control of where they go. I mean, for so many of our clients, control has been taken away from them. And I think
Yeah.
it's really important that they're able to let me know what takes their interest, what happens to them when they even think about picking up a guinea pig,
Mm.
and how they might approach that. So it really is about meeting people where they're at. And for me, I have the luxury of having lots of choice. We have lots of animals on the farm. I had one client that was really, we'd take a walk around the farm, and for a few sessions, we'd go hang out with a few of the animals. But after a while, we just went to hang out with the goats. She just loved the goats. And they were wonderful. They were absolutely brilliant. Like, a lot of our conversations were around boundaries and bullying. And the goats, I mean, I don't know if you've ever had the pleasure of working or hanging out with goats, but
I had a friend who
goodness
had a
me,
goat. Yep.
they're very playful, very curious. And they were coming over, and one day they were just being super annoying, like just butting their heads up against both of us, just constantly like knocking behind my knees. And I was like, let's talk about boundaries. Like, is this okay? Are we gonna? Are we going to just stand here and let them push us over? This doesn't feel quite right to me. How often do you get to do that and have that here and now? Like, we're going to put a boundary up right now. How might we approach that? But in terms of the other side of the coin, you've also got to think about the animals' welfare. And there's an international organization called IAHIO. I'm not even going to attempt to remember what actually stands for. The International Association of Human Animal Interaction Organizations.
Okay,
But
you've
but
done
anyway,
well.
they I might have missed something out there, but yeah, IAHIO, they've got some really useful stuff around animal welfare. Animals, as co-therapists, they get burnout too because they're so attuned to our emotions. And
Yeah.
they've got like a Prague Declaration, which is worth checking out, which talks about animal welfare standards. And if you're working with a therapy dog, they need regular breaks, they need playtime, they need fresh water. So I try and rotate around the animals on the farm so that you're not constantly, the animals aren't getting burnt out or tired or bored, or that they enjoy their work as much as I do.
Yeah, nice. And do you have certain animal on the farm that people do tend to gravitate towards?
Everyone is so different.
It's like a projective test.
It is. No, it is. It's like a modern day Rorschach. It's really interesting. I'm working with a family at the moment, and we're walking around the farm, and one of them, this cow, we've got a lovely dairy cow that came galloping over to us, and half of the family were like, "Amazing, she's come to say hi. That's so cool." And the other half were like, "That's a big cow. I'm gonna go stand over here." So that was really interesting because it really mixes up the sort of the family roles, and you get to see people experiencing different stuff over a relatively neutral kind of stimulus, I suppose. And then a bit later on, we're walking around the farm and we had the joy of seeing a wild rat just run across the paddock into the pigsty. And it completely switched. So the people that hadn't wanted to hang out with the cow were like, "That's a really cute rat." And the other half were like, "Cute rat? Sorry." And it's brilliant. People are drawn to really different stuff, and it gets people thinking about that. There
Mm,
isn't a particular animal that has a special status, but we all have different connections and identifications with different animals. And
mm.
part of the joy of a lot of the work is the metaphors that come out of it, and seeing how people identify with different aspects and what that shows them about themselves as a mirror to their internal world, their landscapes, and their relationships, and what they expect of other people too.
Absolutely, whether it's individual or in a group. And I imagine that when you are walking around, say, with a family, it's also going to give you insights to their dynamics. And if
Oh,
someone
yeah.
is scared or whatever their reaction is, like who kind of jumps onto that? Who's really attuned to it? It sounds really powerful, Abby.
Really powerful and really diverse. There might be some days where we just take yoga mats out into the field and we just hang out and look at the animals and notice their herd dynamics and their social relationships and what that might tell us about our social dynamics.
Mm.
Other times it might be doing a team building exercise, and other times we might be trying to do something more interpretive or more here and now grounding. And it's such diverse work. I really think that, your creativity and your imagination is the limit of this kind of work.
It sounds like that. And it's making me question my career decisions. I want to be working with animals. It's amazing. All right. So we did segue a little bit into, or you gave a little bit of like a intro to the other study we were going to talk about today, which is around cognitive testing with young people and having dogs involved in that process. And I think what might be useful to kind of set up this discussion of why it could be useful to have doggos around is for you to talk a little bit for listeners who might never have gone through cognitive testing or who may be trained in psychology, but that's not what their career or workplace looks like in setting up. Okay, why might cognitive testing be impacted by the level of anxiety that the person you're working with is experiencing?
Yeah, sure. So, I mean, cognitive testing is hopefully something that a lot of people don't have to go through. It's generally something you only do if there's real sort of clinical need. But I think most of us can relate to the experience of being tested, of going through exams or, some kind of presentation or an assessment of some kind. And hopefully you can bring to mind I mean, we all have different relationships to being tested, but it usually brings up some kind of feeling, some kind of nerves or anxiety. And for some people, particularly young people that come into mental health services, they've maybe not had such a great experience. of adult being in a position of, again, power being taken away from them, of loss of control. And there can be something,
Mm.
for some people, some love it, some really thrive on it, but for a lot of people it's a really terrifying prospect to come and sit in a room with an unfamiliar adult and do a series of tests, a lot of which are conducted with a stopwatch, and I might have a clipboard and a pen, and I'm literally have to keep to a script. So because these tests are standardized, and they're tests of things like memory, they might be tests of frontal lobe functioning. So here's where we get into some more sort of neuroanatomy and neuroscience. But the frontal lobes are part of your executive control system. So the planning, organization, that kind of conductor of the brain. Or we might be looking at the temporal lobes, that kind of memory system, and the difference between your sort of visuospatial memory and your linguistic memory. And to do that, we've got these wonderful standardized tests, which, scientifically brilliant, but as an experience to actually do them, particularly when we're doing them for a reason. So for young people, it might be to get them a special educational provision, some extra funding, extra support. So well intentioned, but it doesn't take away from the fact that you've got maybe 2 hours of sitting in a room with someone being asked to say numbers backwards in fives, or to build
Mm.
blocks that look like a picture on within a time frame, and to remember a list of words. And it's quite stressful for a lot of people. Now, because it's standardized, there's a script that you have to read off. You can't really be a human in these tests. It's quite hard. It's, it's something that I've done a lot of cognitive testing in my time. I used to work within an epilepsy service where we did this as part of surgical workup. So really high stakes. The outcomes of these tests would really influence whether or not someone actually had a part of their brain removed. So really,
Right.
really serious stuff. And you have to try and find a way to reassure people so that you get the best out of them, and so they have a good experience, but the results are actually valid and a true
Mm.
reflection of their ability,
Mm.
but without ever deviating from this script that you have to say these specific words at this specific order, and I have to use a stopwatch, and I have to, and you can't bring in a carer or a family member, and you can't really do much that might reassure you. And as a young person, in particular, who might not have developed those kind of self-soothing strategies, and who might have had really challenging experiences of being tested at school, they might not have done so well in those experiences. It can be really challenging as a healthcare provider to offer those tests. And I was working in a child and adolescent service and really finding this dilemma quite upsetting, and wanted to find out, is there something we can do that would change the environment that these young people are in? So, okay, I'm not going to argue with you that they can't bring in mum or dad or whoever it is to sit with them.
Because what's the risk there, Abby, that they're going to influence them and like maybe try to help them out or put pressure on or.
Exactly so, yeah. I mean, even the most well-intentioned parent might stiffen, or, they're kind of like leaning in. I mean, I've been in a number of cognitive assessments where people have said, come on, you know this one, or you were able to do this yesterday, and tell
Yeah.
the lady.
I mean, I might be thinking more of like a trauma background, but there are kids, especially around attachment disorders, where they're going to be really attuned to body language and facial
Yeah,
expressions. Yeah.
yeah,
Okay.
absolutely. And, as much as you want to kind of put people at ease, there's a real limit to what you can do as the examiner, I suppose. So we started thinking about what can we do to the test environment that might make it feel a bit more comfortable for these young people. And naturally, my instincts led me to thinking about dogs, and I was really aware that they're being used in criminal justice settings as support for young people that are testifying, or child witnesses, or victims of
Ah.
crime. There's quite a lot of work coming out of the university I was at the time, Canterbury Christchurch, looking at justice dogs. And so it was a natural extension of that for me, thinking, okay, well, there's literature out there about that setting. I wonder if there's literature out there about cognitive assessments, because if there is, then we might have some kind of inroad to helping to just settle people a little bit into this process. So I got reading around it and ended up doing a review article about what's out there. And actually, there really wasn't a lot of literature out there, and it certainly wasn't about clinical applications of testing. It was very much about schools, and there were a couple of articles around children with attachment traumas and how they respond to testing. But there's only really 3 labs out there across the world that seem to have looked into this stuff. So it was a pretty rudimentary study, really, but interesting just to find that out, I suppose, that people aren't
Absolutely.
looking into this
Yeah.
when actually I think it has huge potential. So, through the course of the work, we were looking at the impact that a dog might have both on the emotional process, but also on the outcome, the cognitive performance. And I suppose the sort of naive model I had in my head was that if we have someone who's feeling anxious, we all know that once anxiety gets to a certain point, thinking kind of goes offline.
Right.
That executive function of the brain, that's no longer necessary. We're right in the limbic system thinking fight or flight. How do I protect myself? How do I get out of here?
Yeah, that exact part of the brain that you're trying to assess through cognitive testing. Great.
Yeah, exactly. It's gone, right? So that's initially a huge problem, right? So not ideal. We're trying to assess that part of the brain. That bit's switched off. Oh dear. So yeah, the idea was that if we've got something that helps to kind of bring thinking back online by bringing that anxiety down somehow, some kind of social support, and we know from the literature that animals can be experienced as a social support. Just look at the pet study.
Yeah.
Then we've got something that could potentially bring thinking back online, and then hopefully cognitive performance is more valid, right? We want people to perform to the best of their ability, to give a true sense of what their ability is, because then we know what their needs are and we can support those needs.
Yeah.
So that was kind of the working model in my head, and the papers I looked at kind of fell into 3 kind of categories, which in the end formed quite a nice sort of process model of how this actually might work in practice. So some of them looked at the relationship between animals and attention, and some of them looked at the relationship between animals and attachment, and some of them were looking at something else I can't remember. But essentially we ended up in a place where they kind of tie up really nicely to show that being in the presence and interacting with an animal seems to bring down cortisol, so one of our stress hormones, by activating, it seemed like by activating the attachment system.
Mm.
So when we're under that fight or flight response that gets triggered, we seek proximity to an attachment figure. The literature shows that animals can be attachment figures. So if a child is able to activate that attachment system and to release some oxytocin and those kind of feel good hormones, the cortisol decreases and the thinking system comes back online. So,
Mm.
quite a simple attachment based model of how animals can help us to kind of reach our true thinking potential. And I suppose, in a clinical setting, we might think about that in terms of grounding again. We're back using the whole brain. The emotion system can talk to the kind of thinking assessing system. And there's that bidirectional feedback again, which is so helpful in therapy. And in cognitive assessments, crucial for being able to
Mm.
count backwards in threes. So,
Right. Yeah.
so that was kind of the pretty simple outcome of that study. Now, what needs to happen is research actually looking at clinical testing. And it's complicated because, like I say, these tests are standardized. They're not standardized with dogs. So, actually, we've then got the thing of what happens if a dog gives someone an advantage. So, my argument would be that, the dog's not giving you the answers. It's actually helping you to access your potential and
Mm.
your ability, your natural ability. But I suppose it's about equality of opportunity and making sure that people have that option if they think it's supportive to them, if that's the kind of thing we're going to bring into services. So maybe starting to look at this in sort of pilot or feasibility studies, seeing whether or not this is possible, what the outcomes might be in a clinical setting, because the argument you always hear is, well, the dog could be distracting, or it might put the examiner off, or the child might have phobias or allergies. Like, for sure, don't put a dog in with someone that has a phobia of dogs. Like, that's not going to help them. Or allergies, like, you're going to have to do some kind of risk assessment around this beforehand. I'm not saying it's a panacea. But actually, that argument about the dogs being distracting is really interesting. So the studies I looked at actually found so that one of the studies was looking at preschoolers in America, sort of 3 to 5 year olds, and they would do these kind of experiments where they would have a task the child needed to complete, like balancing, an egg and spoon race or something like that. And they had 3 conditions where they would have one where the child would do it with just verbal instructions, like they'd tell them what to do, and then they had one where they were given a human supporter and one where they were given an animal supporter. And actually, the number of repetitions of instructions was the lowest in the animal supporter condition. People were able to listen and take in the information when they were with an animal much better than with a human or with nothing.
Wow.
And people learn quicker from an animal model than they do from a human model. There's actually something less distracting about an animal than a person. Because I think probably, and I don't know, this is pure speculation, but what you were saying about attunement to body language, what's that person thinking about me? Am I making appropriate eye contact right now? All of that
Mm.
stuff goes through our head in a split second. And we
Mm.
might find that we've been listening for 5 minutes and have no idea what that person said. But with an animal, the attachment system is activated. We're feeling calm, we're attuned, we're listening, we're integrating information into our database of how we do stuff already
Mm.
and just get on with it.
Mm. I was reading through the paper and noticed the part where you said, anecdotally, one of the studies said that these effects held true even when the child said they didn't like the dog.
Yeah.
Even when it wasn't like, I'm enamored or I'm so fascinated, it was like this still had a positive effect on the testing and ability to listen and perform tasks.
Yeah. And, I think it comes down to something again biological that happens. So, a really, really interesting study that I came across at a conference was taking place over in Canada. And they'd done this study where they'd taken photographs, again, a randomized control study, I think, from memory. They'd taken photographs of therapists, just headshots. And they'd taken 2 photographs of each therapist, same headshot to all intents and purposes, except out of sight in the picture. In one of the pictures, they've got a dog with them at their feet, and in the other one, they don't. Okay, so they've randomized it completely, and then they've asked people to rate how likable and trustworthy these therapists are. And they found that if the dog, not in the picture, you cannot see the dog. They didn't know anything about dogs, the participants that were doing this study. They were just rating pictures of therapists. What they found was the therapists that had dogs at their feet were more likable and more trustworthy. They're just looking at their head. They don't even know a dog is there. They have
Oh,
no
wait, what?
idea. Yeah, yeah, that's what I'm saying. So they're just looking at the headshots. The dog is out of sight.
This is the
Yeah,
effect of the presence of the dog while the photo's being taken and the
yeah,
observer only sees the face of the clinician.
yes, yes,
Oh, mind
yes.
blown.
Mind blown. And I would love to see, I don't know how rigorous the research was. I haven't properly torn into it, but I would really love to see how this stands up and maybe see some replications of that because what a mind-blowing finding that is.
I'm just blown away by this. This is what, like potentially the release of dopamine or oxytocin that then somehow impacts facial expression, and we can see that in another human.
Yeah. Yeah.
Oh, that is cool.
Yeah. So subtle. It's amazing, right? And I think if we think about the kind of work that we do as clinicians, we're trying to offer people a safe space in order to talk about really difficult stuff, whether we're doing clinical testing or whether we're talking about traumas or difficulties in people's lives, whatever they may be. We're trying to offer a safe space, but in response, we're hearing difficult stuff which might interact with our own experiences too.
Yeah,
And for various reasons, we might feel a little on edge at times. There might be sort of threat signals that we pick up. If
for
someone's
sure.
really getting in touch with an experience of anger or aggression that they've either experienced or for whatever reason, we might feel threatened. Now, if we are feeling safe because we've just had an interaction with a dog or if we've got a dog in the therapy room with us, I think that has huge potential in terms of being
Mm,
able to really stay attuned to our clients' experiences and be
mm.
able to contain their emotions because our emotions are contained.
Yeah. And you have that grounding yourself, but also whether or not the person you're working with can see that animal apparently pick that up, that
Yeah,
warmness or calmness. That's that's incredible.
yeah, really exciting stuff. So, yeah. Huge ramifications. And actually, we're just starting to see that come through now. So, the service I'm working in at the moment, we are about to pilot an intervention for staff wellbeing. So, I don't know how it's been in Australia, but I can imagine this is a worldwide phenomenon where healthcare workers are really struggling.
Yeah.
I think particularly with the pandemic, but just in general in the UK, we've had a real staff wellbeing problem for a long time. There's been various papers written about the experience of psychologists and psychotherapists and people that work in the mental health sphere in terms of
Mm.
their well-being for various reasons, both the content of the work, but also the pressures and the funding situation,
Mm.
workload and the hours and that kind of stuff. So it's been an issue. We have generally quite a difficulty retaining staff within services. There's a really high sick rate. And
Yep.
this isn't just my service, this is across the UK. This is what the data shows. And of course, that has a negative experience for the clients because we've got inconsistent care. We've
Yes.
got the unpredictability of a therapist is off sick this week. That means I don't have a session. They might be off sick for 6 months, which means I have to go see a new therapist and start all over again.
Mm. Mm.
Really challenging. And of course, it's, from an operational perspective, it's expensive recruiting staff, training them, induction periods, all of that stuff. So everyone
Yeah.
recognizes that this is something that needs to be thought about. Everyone wants happy, healthy staff. And we're just starting a quality improvement project off the back of these two papers where we're going to trial bringing in a therapy dog for staff wellbeing and just see where that takes us. I mean, my hope and ambition would be that one day we can have a staff pet policy. So some corporates have this, like Nestle are really leading the field with this, where they have like a pet passport and the dog gets registered with HR and they have to be vaccinated and they have to be well behaved and all of that stuff, but they're allowed to come in and out with staff at the office. And I think when we started talking about this in my team about 12 months ago, again, people just light up. They're like,
Mm.
yes,
Mm.
that is absolutely. And people have been emailing photographs and emailing their enthusiasm to the clinician that's leading this project, one of my supervisees. And it's just such a heartwarming experience. There are people out there that are doing this kind of work, and there are all sorts of risk assessments that we can borrow from other teams and develop and try
Mm.
and do this really safely. And I think the beauty of a quality of improvement project is that we've got a really nice time frame around this where we're going to do it for, I don't know how long we're going to do it for actually, but probably like say we're going to do it for 6 months and then
Yeah.
it's going to end. And so, we're not suggesting a permanent change to our service, but more we're going to trial something. We're going to evaluate it. We're going to find out what people's experience was of this, take all of that into account and see if it's something that's worth doing again or expanding on or widening in some way. If it doesn't work, we won't do it. And that's the beauty of the research practice links, right?
Exactly. Yeah. Well, I look forward to catching up with you later and hearing how that went.
Yeah, definitely. And it's been so interesting during the pandemic and seeing how many people are working from home. And I've seen so many sort of anecdotes about people that have been able to work with their pets in the office space and how that's really improved their quality of life.
Yeah.
And what the research shows is it probably improves the quality of their work as well. Mm.
Interesting.
But really brings us back to the fact that, you can sit and because of that attachment system, you can focus in on the work that you're doing and it really helps us to feel safe and regulated whilst we're working. But also, that dog's going to need regular breaks. They're going to need to go outside, they're going to need some fresh water. You also need fresh water. You also need to go
Yeah.
outside.
Yeah.
It really attunes us, I think, to that sense that it's not that healthy actually for us to sit for 14 hours and not eat or drink or stand up and stretch and move around. And
Mm.
I think for a lot of us, that reminder is something that we could really do with.
Like, oh, yeah, I need to eat and pee now. That that would make me feel more comfortable and productive. um, yeah, it's a really good point, Abby. All of this is really exciting, and as an animal lover, it's really cool to hear about these changes and fascinating experiments that are being done that just reaffirm the bias that you have when you love dogs or when you love animals. That feels intuitively right to see science behind it and the way that it's incorporated into something as important as clinical psychological practice is amazing. So incredible. I've really enjoyed our conversation.
Yeah, me too. It's really nice to have the chance to talk about it. It really excites me, this kind of work and this field. And it's really nice to see other people interested in it too. Hope we can spread the word.
Yeah, absolutely. For those of you at home, that's all for today. Show notes for the episode can be found at www.psychattack.com. If you've enjoyed listening to Psych Attack, please rate it on your favorite podcast platform and share this episode to help other people find the show. If you have questions or feedback, you can reach out on Twitter at PsychAttackCast. Thanks for listening, and we'll catch up with you again next time.